Veteran singer Bappi Lehiri, fondly known as Bappi Da, breathed his last in Mumbai. According to reports, he died due to obstructive sleep apnea. Sleep apnea is a potential serious sleep disorder in which breathing repeatedly stops and starts. If you snore loudly and feel tired, even after a full night's sleep, you might have sleep apnea. The main types of sleep apnea are: Number 1. Obstructive sleep apnea is the more common form that occurs when throat muscles relax. Number 2 is central sleep apnea occurs when your brain doesn't send proper signals to the muscles that control breathing. Number 3 is complex sleep apnea syndrome, also known as treatment emergent central sleep apnea, occurs when someone has both obstructive sleep apnea and central sleep apnea. The signs and symptoms of obstructive and central sleep apnea overlap, sometimes making it difficult to determine which type you have. Loud snoring can indicate a potential serious problem, but not everyone who has sleep apnea snores. Talk to your doctor if you have signs or symptoms of sleep apnea. Ask your doctor about any sleep problem that leaves you fatigued, sleepy, and irritable. When the muscles relax, your airways narrows or closes as you breathe in. You can't get enough air, which can lower the oxygen level in your blood. Your brain senses your inability to breathe and briefly rouses you from sleep so that you can reopen your airways. This awakening is usually so brief that you don't remember it. You might snort, choke, or gasp. This pattern can repeat itself 5 to 30 minutes or more each hour, all night, impairing your ability to reach the deep, restful phases of sleep. This less common form of sleep apnea occurs when your brain fails to transmit signals to your breathing muscles. This means that you make no effort to breathe for a short period. You might awaken with shortness of breath or have a difficult time getting to sleep or staying asleep. Factors that increase the risk of this form of sleep apnea include excess weight. Obesity greatly increases the risk of sleep apnea. Fat deposits around your upper airways can obstruct your breathing. Number 2 is neck circumference. People with thicker necks might have narrower airways. Number 3 is men are 2 to 3 times more likely to have sleep apnea than women. However, women increase their risk if they are overweight, and their risk also appears to rise after menopause. Number 4 is smoking. Smokers are 3 times more likely to have obstructive sleep apnea than are people who have never smoked. Smoking can increase the amount of inflammation and fluid retention in the upper airway. Sleep apnea is a serious medical condition. You might also feel quick-tempered, moody, or depressed. Children and adolescents with sleep apnea might perform poorly in school or have behavior problems. But you don't have to worry, because one can substantially manage OSA with treatment and by making certain lifestyle changes like exercising, losing excess weight, eating balanced meals, and avoiding smoking and drinking.
Thanks for watching. Please subscribe and hit the bell icon.